Breast cancer is the second leading cause of death among all cancers. It is also the most common cancer among women. It was estimated that 270,000 new cases of breast cancer would be diagnosed in 2018. However, current diagnostic technologies such as mammograms, tomosynthesis, and full-field digital mammography are inaccurate, with high false positive and false negative rates. Therefore, the future of breast cancer detection is in dire need of advanced technology with marginal error.
Mammography is a diagnostic tool that uses low-dose X-ray systems to examine breasts. It is used to aid in early detection and diagnosis of breast cancer. Mammography has high incidences of false negatives. So much so that mammograms miss nearly 1 in 5 cases of cancer. Based on estimation, that means in 2018, over 68,000 patients were told that they did not have breast cancer even when they did. Mammography also has high incidences of false positives. More than half of U.S. women screened annually for 10 years experienced false positives, which means they were told that they did have breast cancer when they did not, leading to unnecessary and expensive biopsies or treatment. New diagnostic technologies have now emerged that implement computer science. These are designed to improve the accuracy and precision of early detection. One of these new technologies is tomosynthesis, which is 3D mammography. It is a digital X-ray mammogram which creates 2D and 3D-like pictures of the breast. An X-ray arm sweeps in a slight arc over your breast, taking multiple low-dose X-ray images. A computer software creates 3D images of the breast. This technology allows radiologists to examine these images taken at different angles, and it enables them to better resolve ambiguities or dense tissue compared to 2D images.
Full-field digital mammography is a type of imaging that converts X-rays into electrical signals using solid-state detectors, similar to detectors found in digital cameras. The electrical signals are then used to recreate images of the breast that can be viewed on the computer or printed in film. Then the images are analyzed through computer software. These computer-aided detection systems, also called CAD systems, use the digitized mammographic images to search for abnormal areas of density, mass, or calcification that may indicate the presence of cancer.
On the left is a radiograph taken with standard mammography imaging, and on the right is a radiograph produced by full-field digital mammography. As you can see, the use of these computer-aided detection softwares enhance image quality and detail the tissue more clearly, which both help radiologists make accurate diagnoses. While tomosynthesis and full-field digital mammography utilize advanced technology and underlying computer science principles, they still fall too short. Large studies have shown that tomosynthesis does not have significant error rate differences compared to standard mammography, and full-field digital mammography still produces 10% false positives. Thus, the question remains, what next? Artificial intelligence, deep learning, neural networks, big data, data-driven diagnosis. These are on the forefront of medical technology and can be used to diagnose breast cancer with up to 99% accuracy. Artificial intelligence can be defined as a system that perceives its environment by identifying characteristics and patterns and makes decisions that maximize the system's chance for success. The system of artificial intelligence consists of convolutional neural networks used in deep learning image recognition algorithms to train computers to create patterns based on large empirical datasets. The basic framework of convolutional neural networks mimics that of the sensory cortex in the human brain, which consists of the processes of encoding and decoding. Encoding is the transformation of stimuli from the environment into patterns of neural activity, while decoding is the process by which neural activity generates behavior and outcomes. In breast cancer detection, computers are trained on radiographs of cancerous and non-cancerous types. This deep learning is part of the encoding step, where the radiographs are the stimuli and the computer is converting this into digital stores. With enough training, these artificial intelligence systems will be able to decode stimuli, in which when presented a radiograph, the computer can use its collection of digital stores and pattern recognition to determine whether the radiograph is of cancerous or non-cancerous tissue. Effective deep learning to create the convolutional neural network requires many radiographs for the computer to train on, which is where big data comes into play. The system of artificial intelligence is a way of analyzing and consolidating large data sets of radiographs. Without big data in this application, the technology will fail. UCSF is an institution that is in the process of deep learning their machines. They have trained their technology with over 800,000 radiograph images, but their goal is to reach millions of more in order to assure effective training of their technology and improve accuracy. Another benefit that will come from using artificial intelligence technology is that it will better classify existing cancer through recognizing patterns of tissue growth in calcification in cancerous tissue, research that is still ongoing. Overall, this technology will reduce overdiagnosis and decrease recall rate in biopsy, as well as improve early detection and finding interval cancers. Radiology oncologists can only have so much precision in their diagnoses. With the help of this technology, precision and accuracy rates will be near perfect. Millions of lives will be protected and improved.